In the previous session, we have discussed different nuclei of the basal ganglia, and today we want to talk about the pathways of the basal ganglia. That means input to the basal ganglia, output from the basal ganglia, and the intrinsic connections within the basal ganglia. What's up, ladies and gentlemen? Welcome back to NeuroSketch with Dr. Ken. But if this is the first time you're seeing this channel, don't forget to subscribe. Today we're going to talk about the pathways of the basal ganglia, input, output, and the intrinsic connections. But before we continue, let's have a quick recap on the previous discussion. So we saw we have nuclei of the basal ganglia and their function. We saw the striatum is mainly acting as input to the basal ganglia. The globus pallidus has got two segments, external segment and the internal segment. And the internal segment is acting as output from the basal ganglia system. But we have the subthalamic nucleus whose function was to suppress unwanted movement. We're going to see how. But we also have a substantia nigra substantia nigra with the two parts. Pars compacta and pars reticulata. The compacta one is releasing dopamine to facilitate movement, and the reticulata is involved in controlling of the eye movement. And then we also have the nucleus accumbens, which is dealing with the motivation and the goal directed behavior. So let's go to our point of discussion today. Input to the basal ganglia, as we have already discussed, the main input gates to the basal ganglia are the striatum and the nucleus accumbens. That means if you want to go to the basal ganglia system, then you will have to encounter the striatum or the nucleus accumbens. But the main input to the basal ganglia is the striatum. What is the striatum made of? It's made up of putamen and caudate nucleus. Caudate nucleus and the putamen together that form the striatum, and the striatum is the main input to the basal ganglia. If I told you have information that you have to send to the basal ganglia system, then it will have to go through the striatum, or on a rare occasions it can go to the nucleus accumbens. But where are these inputs coming from? What are the input options? Yes, we know this is the gate which is receiving the information that is coming to the basal ganglia system, but where are these informations coming from? So the cerebral cortex is the main input to the basal ganglia. The main input to the basal ganglia is from the cerebral cortex, and it uses glutamate as a neurotransmitter. And remember, glutamate is an excitatory neurotransmitter. We have a separate discussion talking about the neurotransmitters, but for today we see we have glutamate, which is coming from the cerebral cortex, is an excitatory neurotransmitter. That means the cerebral cortex is exciting the basal ganglia through the striatum and the nucleus accumbens. But we also have input from the substantia nigra pars compacta. This is the substantia nigra pars compacta. It fires its input into the striatum, and the substantia nigra pars compacta uses dopamine as a neurotransmitter. And we are going to figure out later in the nigrostriatal pathway, which I believe is a different discussion, we'll figure out that the dopamine can act as both excitatory neurotransmitter and inhibitory neurotransmitter, depending on the receptors that they are acting upon. So the substantia nigra pars compacta uses dopamine to fires its input to the striatum. We also have input from the thalamus. So this is the thalamus, and you see it fires its input into the putamen, and the putamen is one among the parts of the striatum. And for convenience, they couldn't draw different lines here. Just for convenience, they've drawn a simple line to the putamen, but the putamen here represents the striatum. Same as we have seen from the cerebral cortex, we have information which is coming to the caudate nucleus, but it goes also to the putamen. This is just a representation of one another to have a clear picture of what is going on. But we also have input from the brainstem, and from the brainstem the input is coming through the serotonin. The serotonin is referred as a mood hormone. This is what controls your mood. When you go to gym, you go to different pleasurable places, is to activate your serotonin, and this is what gives you a mood. But it also does controlling the of appetite and the digestion. It also is important in regulation of sleep cycle and the induction of sleep for you to fall asleep. But it's also involved in regulation of cardiovascular function and controlling of the smooth muscle contraction. Okay, now let's go to the output from the basal ganglia. The output gates from the basal ganglia are the global spiders internal segment and the substantia nigra pars reticulata. We have already discussed about this. These are the main output gates. Like if you want to leave from the basal ganglia system, then you have to get out through these two nuclei. Number one, this is the internal segment of the global spiders, and this is the substantia nigra pars compacta. These are the main output gate. But if you want to go into details, you will understand that the substantia nigra pars reticulata is dealing with the information about head and neck, and the global spiders internal segment is dealing with the information from the rest of the body. So the output from the basal ganglia system with the information about head and neck is being mediated by the substantia nigra pars reticulata, and from the rest of the body is being done by the internal segment of the global spiders. But remember, these are just gates. Yeah, this is the way that they are leaving the basal ganglia system. So what are the output options? Where are these informations going to? These informations are going to, you see, thalamus. So thalamus is the main output option from the basal ganglia system. The output gates of the basal ganglia system are the internal segment of global spiders and the substantia nigra pars compacta, but this information is going to the thalamus. The thalamus is the main output option of this information which is coming from the basal ganglia, and the information from these two nuclei that are being mediated by GABAergic neurons. That means they're utilizing gamma aminobutyric acid as a neurotransmitter, and you all remember that GABA is an inhibitory neurotransmitter. Neurotransmitter. So the main output pathways are to the thalamus via the thalamic fasciculus. Now we have already seen what is input to the basal ganglia, what is output gate of the basal ganglia, what are the output options to the basal ganglia, which is the thalamus, what are the main input option from into the basal ganglia is from the cerebral cortex. But you are yet to see what is happening in between. What is happening in between? And this is what confuses a lot of people, and let's figure out together. So from the striatum to the output, we have two pathways or two options. Option number one, the information can go from straight from the input to the output. Remember, this is the input, this is output. So the information can go straight from the input gate to the output gate, and this will be referred as a direct pathway, directly from the input to the output. And on the other hand, we have this information which is coming from the input, but it goes through a series of nuclei before it finds the output, and this is referred as indirect pathway. So these are the main two pathways of the basal ganglia system in the intrinsic connection. So the direct pathway is also referred as a go pathway because this is one that facilitates movement, and the indirect pathway inhibits unnecessary movement, unwanted movement. So in simple words, the direct pathway promotes movement, the indirect pathway inhibits movement. So in other words, someone can refer this as a go pathway and the indirect pathway as a stop pathway. So it inhibits unnecessary movement and suppresses unwanted movement. So for example, when you about to make a certain movement and you stop right before you do it, that is exactly what is done by the indirect pathway. So for example, when you want to slap your friend and you stop right before you do it, that's indirect pathway which is in action. So this is a simplified diagram. Let's now dive into details of what's really happening within these pathways. So this is what direct pathways looks like. Yeah, so we have the main input from the cerebral cortex as we expect, and the main input is going to the striatum. So this is striatum again. They are using putamen just as a representative of this striatum. And from here, we've said this is a direct pathway, and we've said in the direct pathway, as soon as the information is entered in the input gate, it goes to the output gate. So what is the input gate? The striatum. What is the output gate? The internal segment of the global spiders. So you see this information is coming to the striatum, and then from striatum directly to the internal segment of the global spiders, and from there it goes away. So this is exactly like this one. So let me show you. We have input from the cortex to the striatum, and then from striatum directly to the output, which is represented here by the internal segment of the globus pallidus. Easy, right? And then we have an indirect pathway, and in indirect pathway we see that you have the information is coming from the input options, which is the cerebral cortex, and then from here the information goes to the striatum, and then from the striatum the information goes to the external segment of the globus pallidus. But before it goes to the output, it also goes to another nucleus, which is the subthalamic nucleus. So it comes from the striatum to the external segment of the globus pallidus. From the external segment it goes to the subthalamic nucleus, and then from the subthalamic nucleus this information goes back to the internal segment of the globus pallidus, which is acting as an output gate for this information. And then from the internal segment is where that this information can go to the thalamus. So this is called an indirect pathway, because it goes through a series of nuclei before it finds an output. So let's dive into neurotransmission. This is what happens, but let's see the neurotransmission of this intrinsic pathway. Okay, but before we, yes, so number one, the cerebral cortex uses glutamate as a neurotransmitter. And we already said that the glutamate is an excitatory neurotransmitter, but the interneurons within the striatum, they are using acetylcholine as a chief neurotransmitter, and the acetylcholine is also an excitatory neurotransmitter. Within the striatum, they are utilizing the acetylcholine, but the information from the cerebral cortex is using the glutamate. And then we have neurons that are coming from the striatum. These neurons are called medium spine neurons. These medium spine neurons, they are inhibitory in nature. They are using GABA as a neurotransmitter, and for that reason they can also be referred as a GABAergic neurons, because they're using GABA as a neurotransmitter. A point of note in neurotransmission is inhibition does not necessarily mean total shutdown of information. It can also mean a decrease in activity. This is very important, because we're going to see some neurons are inhibitory, and we're going to say this is just a only decrease in activity. But we also have another important terminology here, which is called tonically firing, and the word tonically firing means actively firing, continuously firing. Okay, let's start with the direct pathway to see what's happening in the direct pathway. Number one, you have the thalamus. Let me start from the output here. The thalamus is the main output. Let's see what's the function of the thalamus in terms of movement. The thalamus is tonically firing electricity to the cortical motor areas. It tonically fires, it actively fires electricity to the cortical motor areas. But the thalamus is being inhibited by these two nuclei of the basal ganglia, that's the internal segment of the globus pallidus and the substantia nigra pars reticulata. They are inhibiting the thalamus from actively firing electricity to nuclei. They tell the thalamus, like, you don't have to fire this much. This is enough, bro. Okay, but guess what? These two nuclei, they're also being inhibited by the striatum. So the striatum is like telling this nuclei that you do not have to inhibit the thalamus. Let the thalamus do its job. Yeah, and what was the function of the thalamus here? Was to tonically fire electricity to the cortical motor areas. So in the end, we are disinhibiting the thalamus. The thalamus was inhibited by these two nuclei, but this inhibition has been removed by the striatum, so that the thalamus is now not inhibited, so it continuously fires the electricity. It's like we have removed that inhibition. We had an inhibition. One more time. This is where it confuses a lot of people. So these are the nuclei that were inhibiting the thalamus, but this nuclei, they've been ordered by the striatum through this GABA not to inhibit the thalamus. So in the end, the thalamus is not inhibited, so it continuously firing electricity to the cortical motor areas. In the end, the direct pathway is acting as a go pathway. It promotes movement, and this is how it promotes movement. Movement. And I figured out you guys might have done electronics in your high school, and you probably know the logic gates, and it would be easy for you to understand logic gates maybe So here is the logic gate. Assume you have a NAND gate. This is a NAND gate, yeah, and then right in front of the NAND gate you have a NOT gate. So what is the output here when you have NAND gate and then you have the NOT gate? It's like you are negating the negative. You are negating the negative. You are negating the low output. So the output here is going to be high. Correct? If you've done electronics, you perhaps understand this rule that if you have a NAND gate and then you are negating, you have a NOT gate in front of the NAND gate, the output is going to be high, and that means positive. But if you didn't do electronics, that's completely okay. I got you back. I believe you did mathematics, yeah, and you remember these rules in mathematics, like if you have products of two negatives, yeah, the answer is going to be positive. If you have a product, negative times negative, the product is going to be positive. And this is what's happening within the direct pathway. Like you have negative and negative, so the product of these two negatives is the positive output, which means we are promoting movement in the direct pathway. So in the indirect pathway, it's a little bit different, and we have, let's count how many negatives do we have within the intrinsic within the basal ganglia in the indirect pathway. So we have a negative, we have a positive, and then we have negative. How many? We have 3 negatives and 1 positive. So what do you think the output would be? Let's put it in a formula. We have -1, this one. We have -1, this one. We have a +1 here and the -1 here. So a product of these two, so a product of all this will be negative. That means the output will be low, and if you put in the logic gate, is also going to be the same, so the output will be low. And this is to say the indirect pathway inhibits movement. Indirect pathway inhibits movement, but it's okay. We can walk along the along this nuclei to figure out what's happening. We've seen the thalamus is tonically active, tonically firing electricity to the cortical motor areas. But this thalamus is being inhibited by these two nuclei from active firing. So in the end, it's like the thalamus does not fire the electricity. And now we have this nucleus which calls the subthalamic nucleus, and the subthalamic nucleus is helping these two nuclei to inhibit the thalamus. So the thalamus is even inhibited more with the presence of the subthalamic nucleus, because this is excitatory neurotransmission, and it excites these two nuclei to inhibit. So it promotes inhibition of the thalamus up to this point. But we see also this subthalamic nucleus is being inhibited by the globus pallidus external segment from supporting. So it's been told not to support these two nuclei to inhibit the thalamus. So in the end, it's like these two nuclei, they have to act alone to inhibit the thalamus. And I've told you, inhibition does not mean a total breakdown of information. So this nuclei will inhibit the thalamus, so the thalamus will have a low output to the cerebral cortex. Correct? But this external segment of globus pallidus is also being inhibited by the striatum, not to inhibit the subthalamic nucleus. So what happens is this and this cancel down. Like this one is told not to inhibit the subthalamic nucleus. The final equation remaining is the subthalamic nucleus is helping these two nuclei to inhibit the thalamus. So the thalamus is even inhibited more. Why? Because the inhibition of the globus pallidus external segment has been removed by the striatum. So the subthalamic nucleus is helping these two nuclei to inhibit the thalamus, and so the output will be low. We will later go to discuss one of the disorders which is called hemibalismus, but hemibalismus is happening here at the subthalamic nucleus. We're going to discuss it later, but it's happening here. But we also have some nuclei here that are firing dopamine, and these nuclei are forming a part of the nigrostriatal pathway. So this is all about the pathways of the basal ganglia. We're remaining with only one pathway, which is called the nigrostriatal pathway. We're going to discuss it later, and then we also have clinical correlates of the basal ganglia. This is a summary. the indirect pathway inhibits, and it's helped to remove unnecessary movement, to make sure that the movement that is intended is done correctly with the direct pathway. The direct pathway is dealing with the intended movement. The indirect pathway is removing unwanted movement, to make sure that the precision of the movement that you are doing is perfectly. And later we're going to discuss these disorders, the hyperkinetic and hypokinetic disorders. We're going to see the role of dopamine in the movement. So too much dopamine means you are dancing, and too little means you are frozen. And see you next time. Bye bye.